If you're over 60, what I'm about to share will make you see your next doctor's appointment completely differently. After speaking with dozens of healthcare workers who finally decided to break their silence, I've discovered the uncomfortable reality about how medical professionals actually approach senior care. These 5 eye-opening truths are affecting the quality of your treatment, your dignity as a patient, and possibly even your health outcomes. One nurse with 30 years of experience told me this is what everyone in healthcare knows, but nobody talks about openly. Don't walk into another medical office unprepared for what's really happening when you're not around. This information could be a game changer for your health. Welcome to Straight Talk about senior healthcare. What you're about to discover will completely shift how you handle medical appointments from now on. Today, I'm revealing 5 hard truths about how the healthcare system really treats older adults that most medical professionals would prefer you never found out. Here's what we're covering. First, the instant judgments that happen the second medical staff see your age. Second, the behind-the-scenes conversations about time and money that directly impact your care. Third, how your real health concerns get filtered through outdated assumptions. Fourth, the medication decisions that aren't always made with your best interests in mind. And fifth, the most frustrating presumption about your mental sharpness that's influencing every interaction you have. But here's the encouraging news. I'm going to show you exactly how smart seniors are turning these situations around and getting the respectful, thorough healthcare they deserve. If you've ever walked out of a doctor's office feeling like you weren't heard, rushed through your appointment, or treated like you didn't understand your own body, this video is going to give you the confidence to change that experience forever. Hit that like button if you're ready to hear the real story. And make sure you subscribe with the bell turned on, because this could seriously improve your healthcare experience. Drop a comment and tell me about the most frustrating thing that's happened to you at a medical appointment. Let's dive in. They size you up as time-consuming and expensive before you even sit down. The minute you enter a medical facility, your age immediately puts you in a mental category that affects everything that follows. Healthcare workers, without even meaning to, start making assumptions about how long you'll need, how complicated your situation will be, and how much resources you'll require. This isn't necessarily intentional discrimination, but it's a built-in way of thinking that impacts every conversation you'll have. Dr. Margaret Walsh, who worked in family medicine for 25 years before becoming a patient advocate, explained it to me this way. Medical training teaches efficiency above almost everything else. When healthcare providers see older patients, they automatically expect longer visits, more questions, multiple health issues, and complex medication situations. Before you've even described your problem, they're already mentally preparing for a difficult appointment that's going to put them behind schedule. The financial pressure makes this bias even stronger. With insurance reimbursements getting smaller and patient loads getting bigger, doctors feel genuine stress when they see appointments that might go over their allotted time. Your legitimate healthcare needs start feeling like obstacles to their daily productivity goals, and that creates tension that affects how they interact with you. Research shows that medical professionals spend significantly less time actually listening to patients over 65 compared to younger patients who come in with identical complaints. Take what happened to Robert, a 72-year-old retired mechanic. He came to his appointment with a notebook where he'd carefully tracked his symptoms for 2 weeks. Before he could explain the pattern he'd noticed, his doctor interrupted and said they needed to focus on one main issue per visit. When Robert tried to explain that everything seemed connected, the doctor just nodded impatiently and said they'd have to prioritize. His back pain got attributed to arthritis without any real investigation, and it took 4 more visits before anyone discovered he actually had a kidney stone that was causing referred pain. This complexity avoidance goes way beyond just managing appointment time. Medical providers often hesitate to order thorough testing for older patients because they're worried about opening a can of worms. They'd rather treat obvious symptoms than dig deeper and risk discovering multiple issues that would require comprehensive treatment plans. The psychological impact affects everything. When healthcare providers approach you with preconceived ideas about difficulty and expense, they're less likely to collaborate with you on finding solutions. Instead, they stick to standard approaches they assume work for typical senior problems rather than investigating what's actually going on with you specifically. Here's how you can change this dynamic immediately. Start every appointment by clearly stating what you want to accomplish. Instead of saying you don't feel well, try something like, "My energy has dropped by half over the past 2 months, and I need to find out why." This transforms you from a vague, complicated senior into a patient with a specific solvable problem. Bring a brief summary that shows you're actively involved in your health. Maybe mention improvements you've seen from previous treatments or lifestyle changes you've made successfully. This positions you as someone who participates in solutions rather than just complains about problems. Ask for realistic timeframes for addressing your concerns. You might say something like, "I know we're working within time limits today. Can we schedule a longer appointment next week to properly discuss my heart concerns?" This shows you respect their schedule while advocating for appropriate care. Take notes during your appointments. When doctors see you writing things down, they realize you're paying attention and will remember what they say. This kind of accountability genuinely changes how they communicate with you. They dismiss your real symptoms by calling them normal aging. Medical professionals have developed a habit of attributing legitimate health problems to the aging process, and it's become such a standard response that many don't even realize they're doing it. When doctors explain away your symptoms as just getting older, they're actually avoiding the work of proper diagnosis and investigation that they'd automatically do for younger patients with the same complaints. Dr. Susan Martinez, a retired internist who now speaks about ageism in healthcare, put it perfectly when she told me that the phrase "you're getting older" has become the medical equivalent of "case closed." It's used to end conversations about symptoms that would immediately trigger extensive testing and specialist referrals if a 40-year-old walked in with the same problems. This isn't scientific medicine based on evidence. It's assumption-based medicine based on age. The numbers are really concerning. Studies from major medical institutions show that the majority of serious conditions in seniors get initially dismissed as normal aging before anyone bothers to investigate properly. Heart conditions get written off as decreased energy from getting older. Thyroid problems become natural metabolism changes. Depression gets labeled as normal adjustment to life changes. Even cancer symptoms get brushed aside as general wear and tear on the body. Consider what happened to Dorothy, a 68-year-old former teacher. For 6 months, she complained about increasing joint pain and morning stiffness to her family doctor. Every single visit ended with the same response that her body was just showing its age and she needed to accept these changes. When Dorothy finally insisted on blood tests, they found severe inflammatory arthritis that had been causing permanent joint damage during all those months of medical dismissal. The dismissal follows pretty predictable patterns. Doctors use phrases like, "That's typical at your age," or "we all slow down eventually," to shut down further discussion about investigating your symptoms. They'll suggest general lifestyle improvements, like more exercise or better sleep, without bothering to figure out why these issues started happening suddenly. Women get hit with double dismissal. with symptoms blamed on both aging and hormonal changes. Men's concerns about physical or emotional changes get waved away as normal male aging. Mental health issues receive especially dangerous treatment, with depression and anxiety attributed to life stage transitions instead of being recognized as treatable medical conditions. The worst part is how this dismissal makes you start doubting your own experience. When authority figures repeatedly tell you that worrying symptoms are totally normal, you begin questioning whether you're overreacting or being dramatic. This self-doubt delays you seeking proper medical help and makes health problems worse. Here's how to defend yourself against this. Always respond to age-based dismissals with specific questions. When a doctor says that's normal for someone your age, ask them what percentage of people your exact age experience this same symptom. Ask what research supports calling this level of symptoms typical. Most doctors can't provide real evidence because they're making assumptions, not medical assessments. Create clear timelines that show sudden changes rather than gradual decline. Instead of saying you're more tired lately, present it like this. My energy levels were completely normal until the first week of October, when I suddenly started needing afternoon naps for the first time in my adult life. This changes your complaint from an aging issue to an acute medical symptom that needs investigation. Ask for equal treatment standards. Say something like, "What tests would you order if I were 45 years old with these exact same symptoms?" This forces them to explain why age alone justifies different medical standards. Often they'll realize their bias and order the appropriate investigations they should have done from the beginning. Use direct language about your concerns. State clearly that you understand aging affects the body, but this represents a significant change from your normal baseline. You're worried this could indicate an underlying medical condition and want diagnostic steps taken to rule out treatable causes before attributing everything to aging. Bring someone with you to appointments. When another person witnesses dismissive behavior, doctors typically modify their responses. Your companion can ask follow-up questions you might forget and help document what was actually said during the visit. They assume you're mentally slipping and can't handle complex medical information. One of the most insulting assumptions in senior healthcare is that older patients automatically have decreased mental abilities. Medical professionals routinely oversimplify explanations, avoid discussing complex treatment options, and make healthcare decisions based on stereotypes about senior intelligence rather than evaluating each person individually. Dr. Jennifer Adams, a geriatric psychiatrist who studies medical communication, explained the reality to me. Healthcare providers consistently underestimate the cognitive abilities of patients over 65. They'll recommend simpler, less effective treatments because they assume seniors can't handle sophisticated medical information or follow complex treatment plans. This creates a terrible cycle where older adults receive inferior medical care based on completely unfounded assumptions about their mental capacity. This assumption affects everything beyond just hurt feelings. When doctors believe you can't understand complex medical information, they don't offer you cutting-edge treatments, detailed explanations of your options, or comprehensive diagnostic procedures. Instead, they default to basic interventions that require minimal patient understanding or participation. Think about what happened to Eleanor, a 73-year-old retired college professor. When she was diagnosed with early-stage colon cancer, her oncologist immediately recommended basic surgery without mentioning newer surgical techniques, targeted therapies, or clinical trials. When Eleanor asked about these options after doing her own research, the doctor seemed surprised and said they were trying to keep things simple for her. Eleanor had to switch doctors to access the same advanced treatment protocols routinely offered to younger patients with identical diagnoses. This prejudice shows up in subtle ways. Doctors speak more slowly, use elementary vocabulary, and provide overly simplified explanations to seniors regardless of their education level or demonstrated intelligence. They skip important technical details that would help you make informed decisions, assuming you won't be able to understand anyway. The medication assumptions are particularly dangerous. Healthcare providers often choose less effective drugs with simpler dosing schedules because they assume seniors can't manage complex medication routines. They'll prescribe once-daily medications that work less well than multiple-dose alternatives, putting perceived convenience over optimal health outcomes. Technology discrimination makes the problem worse. Doctors assume older patients can't use health monitoring apps, electronic medical portals, or digital communication systems. This assumption cuts you off from modern healthcare tools that could improve your treatment outcomes and communication with your medical team. The self-fulfilling prophecy becomes really tragic when seniors start believing these expectations. After repeated experiences of dumbed-down explanations and simplified treatment options, some older adults begin thinking they actually can't handle complex medical information, creating learned helplessness where none existed before. Here's how to shatter these assumptions right away. Start every medical conversation by establishing your background and capabilities. You might mention your professional experience, education level, or any relevant expertise. Say something like, "I managed complex systems for 30 years, so please give me detailed medical information so I can make informed decisions about my health." Ask for complete explanations using proper medical terminology. Request something like, "Can you explain exactly how my condition develops and how each treatment option addresses the underlying problem?" This demonstrates your desire and capacity for sophisticated medical information. Bring evidence of your mental engagement. Show up with articles you've researched about your condition, questions you've prepared based on medical literature, or notes from other specialists. This tangible proof of your involvement forces them to abandon their assumptions about your capabilities. Challenge oversimplified recommendations directly. Ask what additional treatment options would be available if you were 50 years old with this same condition. Tell them you want to understand all available options regardless of complexity. Use technology openly during appointments, access your health apps, reference your digital medical records, or use your smartphone to look up medication interactions right there in the room. When doctors see you're comfortable with technology, it challenges their assumptions about what seniors can handle. Request detailed written information about your treatment options and medications. Say you want comprehensive documentation so you can review and research each recommendation thoroughly. This makes it clear you intend to be an active, informed participant in your healthcare decisions. They prescribe medications to make you easier to manage rather than to actually treat your problems. Perhaps the most disturbing reality about senior healthcare is how medications are often used to control behavior rather than address genuine medical conditions. Healthcare providers frequently prescribe psychiatric medications, sedatives, and mood stabilizers to older patients, not because they have diagnosed mental health conditions, but because these drugs make patients less challenging to deal with in medical settings and care facilities. Dr. Robert Chen, a former hospital physician who now works as a patient advocate, revealed this practice to me. He said he'd witnessed countless situations where medications were prescribed not to improve patient health, but to reduce staff workload and make facilities run more smoothly. Anxious seniors got sedatives, assertive patients received mood stabilizers, and those asking lots of questions were given antidepressants. It's chemical management disguised as medical treatment. The statistics are genuinely shocking. More than 40% of seniors are prescribed at least one psychiatric medication, but only about 12% actually have diagnosed mental health conditions requiring pharmaceutical treatment. The rest of these prescriptions seem to serve administrative convenience rather than medical necessity, and these medications often cause serious side effects, including falls, mental confusion, and increased risk of death. Consider what happened to Marie, a 71-year-old former nurse. After her knee replacement surgery, she became frustrated with slow physical therapy progress and started asking detailed questions about her recovery timeline and requesting second opinions. The medical team labeled her as difficult and prescribed anxiety medication to help her stay calm. The medication caused dizziness and confusion, leading to a fall that fractured her shoulder. While her original knee healed fine, the complications from the unnecessary medication extended her recovery by several months. This medication for behavior control extends beyond psychiatric drugs. Doctors routinely prescribe sleep aids for seniors experiencing normal age-related changes in sleep patterns, not actual sleep disorders. Pain medications are often withheld from seniors with legitimate pain complaints because providers assume they're drug-seeking or exaggerating discomfort for attention. Blood pressure medications are frequently prescribed at doses that cause fatigue and dizziness, making seniors less likely to be active or assertive during medical appointments. When patients complain about these side effects, doctors tend to dismiss them as necessary trade-offs instead of adjusting medications or exploring alternative treatments. Perhaps the most insidious aspect is how these medications often create the very problems they claim to treat. Sedatives cause confusion that gets labeled as dementia. Mood stabilizers lead to apathy that gets diagnosed as depression. Sleep aids disrupt natural sleep cycles, creating actual sleep disorders that require even more medication. Medical facilities often encourage this practice because medicated patients require less staff time and attention. Insurance companies support it because psychiatric medications are cheaper than proper medical evaluations or therapeutic interventions. Sometimes families even request it because they can't handle their loved one's natural emotional responses to health challenges. Your defense starts with understanding exactly what every medication is supposed to treat. Before accepting any prescription, always ask what specific medical condition this medication addresses, what measurable improvements you should expect, and how you'll know when to stop taking it. Be wary of medications prescribed for vague reasons like anxiety or agitation without clear diagnostic criteria. Research every medication independently using reliable medical sources. Look up side effect profiles, interaction risks, and alternative treatments. You'll often find that behaviors prompting psychiatric prescriptions can be addressed through environmental changes, counseling, or treating underlying medical conditions instead. Always demand specific treatment goals and timelines. Say you want measurable objectives for any medication, and if you're not seeing specific improvements within a reasonable time frame, you want to discontinue it and explore alternatives. This prevents open-ended use of psychiatric medications without clear purpose. Request medication reviews with independent pharmacists or geriatric specialists. These professionals can identify unnecessary drugs, dangerous interactions, and opportunities to safely stop medications. Many seniors discover they're taking medications with no real therapeutic benefit. Document your mental and physical abilities before starting any psychiatric medication. Get baseline cognitive assessments, balance tests, and mood evaluations. This documentation helps you spot medication-induced changes and provides evidence if you need to advocate for stopping unnecessary drugs. Create a support network that can advocate for you if medications affect your thinking or assertiveness. Choose someone who will question medical decisions and ensure your voice gets heard, even if psychiatric medications alter your personality or mental sharpness. The most heartbreaking truth about senior healthcare is how medical professionals calculate the worth of your remaining years when making treatment decisions. Behind closed doors, doctors use economic formulas that weigh treatment costs against estimated remaining quality of life, often resulting in older adults receiving inferior care not because of medical factors, but because of age-based value calculations. Dr. Linda Thompson, a medical ethicist who has studied healthcare rationing, revealed the uncomfortable reality to me. Medical training includes concepts that essentially assign numerical values to different people's lives. A 70-year-old's remaining years get calculated as less valuable than a 40-year-old's, influencing everything from surgery recommendations to cancer treatment decisions. It's systematic age discrimination disguised as medical economics. This valuation system affects treatment decisions in devastating ways. Seniors are routinely denied expensive procedures, innovative therapies, and aggressive treatments not because they wouldn't benefit medically, but because the healthcare system has decided their remaining years aren't worth the financial investment. The same surgery readily offered to younger patients becomes too risky or not cost-effective for seniors with identical health conditions. Think about what happened to Frank, a 69-year-old retired electrician. When diagnosed with kidney failure, he was immediately steered toward comfort care and told that dialysis might not be appropriate given his age. Frank had to fight for 2 months to access the same life-saving treatment routinely offered to younger patients. Once he finally started dialysis, he returned to his normal activity level and lived 6 more productive years that he would have lost if he'd accepted the initial age-based treatment recommendation. This discrimination extends to diagnostic procedures too. Expensive imaging studies, specialized testing, and preventive screenings are often denied to seniors based on cost-benefit calculations rather than genuine medical need. Insurance companies and healthcare systems use age as a primary factor in approval decisions, assuming seniors won't live long enough to benefit from early detection or prevention strategies. Mental health treatment receives particularly harsh age-based rationing. Depression and anxiety in seniors are often dismissed as natural responses to aging instead of being treated with the same therapeutic interventions offered to younger patients. Counseling, psychiatric care, and mental health medications are considered wasteful spending for people assumed to have limited remaining time. The tragedy deepens when seniors internalize these value judgments. After repeated experiences of limited care recommendations, many older adults start believing their lives are less worth saving. They stop advocating for aggressive treatments, accept substandard care, and make end-of-life decisions based on society's devaluation rather than their own desires for continued living. Emergency room treatment shows the starkest discrimination. Seniors presenting with identical symptoms receive fewer diagnostic tests, shorter examination times, and quicker discharge decisions compared to younger patients. Emergency physicians privately admit that age influences their clinical decision-making, with older patients receiving less comprehensive medical workups. The economic calculations become particularly cruel around family discussions. Healthcare providers subtly influence families to choose less expensive care options for senior relatives, framing limitations as comfort measures or age-appropriate care. Families get encouraged to consider the burden of aggressive treatment without understanding the full range of available options. Your life has equal value regardless of age, and you must advocate accordingly. Always ask if they would recommend the same treatment if you were 45 years old. If not, demand medical rather than economic reasons for different recommendations. This forces providers to justify age-based treatment discrimination. Research treatment outcomes for your specific condition in patients your age. Many seniors have excellent treatment responses that contradict age-based assumptions. Bring this evidence to medical consultations and demand access to all appropriate therapies regardless of cost considerations. Seek multiple medical opinions, especially from geriatric specialists who understand senior treatment outcomes. Many conditions that prompt comfort care recommendations from general practitioners have effective treatments when managed by doctors focused on aging populations. Use legal advocacy when necessary. Age discrimination in healthcare violates federal laws, and legal advocates specializing in senior rights can help you access denied treatments. Document instances where age appears to influence treatment recommendations rather than medical factors. Connect with senior advocacy organizations that can provide support and resources for fighting healthcare discrimination. These groups understand the system's biases and can guide you through appeals processes and alternative treatment options. Remember that you have the right to refuse age-appropriate limitations on your care. If you want aggressive treatment, comprehensive diagnostic testing, or innovative therapies, you can demand equal access regardless of your age. Your life value is not determined by economic calculations or actuarial tables. Now you understand the 5 uncomfortable truths about how the healthcare system really treats seniors that medical professionals hoped you'd never discover. But here's what makes all the difference. Knowledge gives you power, and you now have the tools to transform every medical encounter from passive patient to confident advocate for your own health. Remember Frank, who fought for dialysis and lived 6 productive years that doctors wanted to deny him? Marie, who overcame unnecessary medication complications to reclaim her recovery? These aren't unusual success stories. They're what happens when seniors refuse to accept discriminatory treatment based solely on their age. Every time you challenge age-based assumptions, demand equal treatment, or advocate for comprehensive care, you're not just fighting for yourself, you're changing how the entire healthcare system approaches senior care. Your assertiveness creates positive changes that benefit every older adult who comes after you. The medical establishment hopes seniors will stay quiet and accept inferior care without questioning. But you're different now. You recognize the biases, understand the discrimination, and have practical strategies to overcome both. Your health, dignity, and remaining years are far too valuable to surrender to age-based prejudice. Start transforming your healthcare experience immediately. You deserve medical treatment based on your individual health situation, not outdated stereotypes about your age group. If this opened your eyes to healthcare discrimination you've experienced personally, smash that like button and share this video with every senior who deserves better treatment. Your experience could help save another person's health or even their life. Comment below and tell me, have you experienced medical ageism? What will you do differently at your next appointment? Let's support each other in demanding the respectful, equal healthcare we all deserve. Subscribe and hit that notification bell right now because every senior deserves dignity, respect, and quality medical care regardless of age. Together, we're changing healthcare one appointment at a time. Like, subscribe, and let's keep fighting for the treatment we deserve.